Hello, good afternoon, everyone. Good afternoon. Okay, well, I'm excited today. We are going to be talking about hormone replacement therapy. This is a topic that's come up several times over the last few weeks. And so once we have a couple of people, a few more people here, we're going to go ahead and get started, okay? Thank you all so much for being here. I'm looking forward to covering this topic today. Hormone replacement therapy. Sometimes people get concerned because they're like, should I take it? Should I not take it? And, it's something that definitely we need to explore. So I'm looking forward to us chatting today. As you come into the Facebook Live, please send me a wave or type your name into the chat box. Hi, Michelle. Thank you so much for being here. Hi, Number. Thank you so much for being here. I appreciate you, ladies. We're going to be talking about hormone replacement therapy today. It's a topic that's come up a lot over the last several weeks, and so today we're going to spend some time talking about HRT, or hormone replacement therapy, and hopefully answering any of you guys' questions if you have any, and giving you guys some food for thought, because it's one of these things that a lot of women have questions about as they reach menopausal age, and some people start having like hot flashes and other symptoms, menopausal symptoms, and so we're going to talk some about that, okay? So let's go ahead and get started. Again, as you come into the Facebook Live, please by all means type your name or wave at me in the chat, and I just want to make sure that I welcome you personally. Again, thank you, Michelle. Thank you, Lee. Thank you guys for being here today. So, thank you again for returning. I am Dr. Madeline, your board-certified OBGYN, international speaker, and published author. I help busy women access accurate GYN information and also birth control options so that they're able to live the most free lives that they can, and also keeping in mind that the more we are sexually healthy, the more our overall health is better. And so I'm excited to be with you all today. Please, by all means, follow me on Instagram, Facebook, and Twitter at Dr. Madeline MD. That's DrMadelinMD. So again, thank you for being here. We're going to go ahead and get started, okay? So, hi, Dr. Banga. Thank you for being here. I appreciate you. So we're going to go ahead and get started talking about hormone replacement therapy. So let's start basically by first defining what hormone replacement therapy is. So hormone replacement therapy is something that comes up often in the discussion as women begin to get closer to menopausal age. Now, we've talked a little bit about menopause in previous Sunday chats, and menopause basically, for most women in the U.S., the average age is 51. But you can go through menopause earlier in your lifespan if, for example, you can have premature ovarian, they call it failure, but it just means that your ovaries stop producing hormones earlier than age 51. Hi, Dr. Sunil. Thank you so much for joining us today. You can also have surgery. If you have surgery and your ovaries are removed, that may also send you into earlier menopause. And so, again, that average age of 51 is not for everyone, but when we talk about menopause, that's what we're talking about. And when we're talking about hormone replacement therapy, we're talking about adding back some of the estrogen and progestins that have stopped being produced by your body naturally when you get to that point. And so hormone replacement therapy is not necessarily needed by everyone, but those women who are thinking about hormone replacement therapy are those women who might have complaints such as, I'm feeling very warm. I can be in an air-conditioned room and I just feel that I need a fan. or I need to adjust the a common one that I hear from women, especially if they're partnered. Their partners might complain that they always want to have the AC going on at a higher rate at night. And so, those are some of the things that women will complain about. There are also different changes that happen when women go through menopause. The vagina, because it's not getting the estrogen that it has been getting for her whole life, the vagina can become drier. And that's also something that women complain about. Night sweats, they're another common complaint if a woman is starting to feel some changes that go along with menopause. And so again, when you think about hormone replacement therapy, it's really thinking about, how do I maintain a quality of life without feeling a lot of these symptoms that are making me not feel as comfortable, okay? So let's talk a little bit more about hormone replacement therapy. It basically contains those hormones that I mentioned to you. Hormone replacement therapy can be just estrogen, or it can be estrogen and progestin. Hey, Pamela, thank you so much for joining. Thank you guys. As you come into the live chat, please just wave or type your name. I just want to make sure I welcome all of you personally. So for best results with hormone replacement therapy, it really has to be individualized. So there's no one size fits all when it comes to hormone replacement therapy. Hi, Nina, thank you so much for being here. I appreciate you. So yes, there's no one size fits all. So there are two types that I want you to think about if you are thinking about hormone replacement therapy, or whether or not it's something that you're interested in. The first thing is absolutely you have to talk with your provider, whether you see a physician, nurse practitioner, or PA. You have to talk with them about your unique situation so that you guys can jointly decide if hormone replacement therapy is best for you. The two big categories of hormone replacement therapy are, hi, Michelle, Dr. Skorka, thank you so much for being here. Hey, Jackie, thank you so much for being here. I appreciate y'all. So the two big categories I want you guys to be aware of are systemic hormone replacement therapy. Systemic means, hey, Kelly, thank you so much for being here. Number, I appreciate you. Systemic means that it comes into your body either through pills. Hey, Patricia, thank you again. Thank you for being here. It comes in through your body through pills or through a patch that you can put on your skin. There are also lotions and creams, but systemic just means that it has a chance to get into your system and go throughout your body in a more a bigger way, a more holistic way, so that everything is getting a little bit of the hormones that come into your body when you decide on systemic treatment. Hey, Chandra, thank you so much for being here. I appreciate you. The other category of hormone replacement therapy for you to think about is just low-dose vaginal products. And so what if you're someone who doesn't want to take a hormone replacement tablet every day, or use lotion, or do anything else, or gel or cream or skin patch? You don't want to do any of that stuff, but you want a little bit of relief. For those patients, what works very well are some of the vaginal products. And so there are vaginal creams that can be prescribed. Sometimes women like them because if the main thing that they're feeling is, in terms of their menopausal symptoms, if the main thing that they're feeling is just vaginal dryness, then just having an estrogen cream that can be inserted into the vagina, a lot of times people like that because it's just a local impact and it's not necessarily going to affect the rest of the body like the systemic medicines do. So again, it's one of these things where with every patient, it's a different conversation. Sometimes patients have information that, they've learned about on Google, or they've discussed with another sister friend or a family member, or even with their partner in terms of what may or may not work for them in terms of their quality of life and their lifestyle, okay? So those are the two big types of categories that I want you to think about. Now, another big topic that is part of the conversation whenever a woman is thinking about hormone replacement therapy, a lot of times women have questions about some of the research studies that happened within the last 15 to 20 years. So let's talk about those so that you guys can know where some of the concerns about high-dose hormone replacement therapy or long-term hormone replacement therapy, where do some of those concerns come from? So there was a study that was published, I would say it's been almost about 15 to 20 years now, that really explored what some risk factors may have been, or some risk outcomes may have been among women who took hormone replacement therapy. Now, it's very important that you understand the women in this study, again, because this is what we knew at the time. So when they did the studies, they were doing the best with what they had, the information that they had at the time. Most of the women were taking very high doses of hormone replacement therapy, and also they were on it for many, many years. So here's what that study showed, and here's where a lot of people have questions. When they used these medicines that had both estrogen and progestin, so two hormones, there was an increased risk of certain serious conditions. Those conditions included heart disease, they included stroke, they included more blood clot formation, which is risky because you can have, if a blood clot gets loose, it can go to your lungs or your heart, and it can cause a pulmonary embolism. And the other thing that they found was had an increased risk was breast cancer. Okay, but again, I always, whenever I'm having this conversation with patients, I always make sure they understand the context. And the context was that at the time, what we knew in terms of dosing and everything, the women had high dose estrogen and progesterone, and they had it over a period of time, after which there were certain conditions that were thought to be increased. When they looked at the data and they did the analyses, those things were increased. Heart disease, stroke, blood clots, and breast cancer. It's one of the reasons why whenever I'm seeing a lady who is interested in starting hormone replacement therapy, it's so important that we get a thorough medical history, a thorough family history. What's going on in terms of your family, in terms of, any history of heart disease? Did anyone in your family die suddenly of heart disease at age 55 or earlier? That's a very, very strong genetic risk factor. For those of you who may not be aware, if you have a family member who passed away from heart disease at age 55 or older, that is a really strong risk factor for you personally, in terms of whether or not you might be at risk if you take additional hormones. So one of the other things that I always talk about with patients, especially my ladies who don't like mammograms and are resistant to mammograms, is always an interesting conversation. Some ladies will say, well, I really want some relief from these hot flashes, but I'm just not going to go get a mammogram. But a mammogram is so important because if we're going to start hormone replacement therapy, it's just important for us to have a baseline. Even though these days we're not giving the same doses of hormones and we're not giving them for as long, having that baseline mammogram is important, because what we don't want to do is start you on some medicine and not be aware of whether or not something was already present at the time we started the medicine. Okay? And so that baseline mammogram is for us to both look at it and say, okay, great, it doesn't look like there's anything going on in terms of any areas or lesions on your breast that appear to be cancerous or something like that. So yes, let's start this hormone replacement therapy at a low dose. Let's try it just for maybe 6 months or a year, see if it helps your symptoms at all, and then we can go from there. It's very important when you're choosing to be on hormone replacement therapy. It's important that you see your provider on a regular basis, at least once a year. I have if I have a patient who maybe doesn't want to come in, but she's checking her blood pressure at home, she's been rigorous about getting her mammogram, maybe I won't have her come in, but maybe I'll do a telehealth visit and make sure she's okay and give her like a 6-month refill. So there's some ways that we can play around with this, especially in the age of COVID. What you'll find is that many more providers are trying to be flexible with requiring people to come into the office if we can be, okay? So I want you guys to know that as well in terms of hormone replacement therapy. So important to know that a woman who wants to try hormone replacement therapy, most times will start with the lowest possible dose, and we will again just try it for 6 months, bring her back in. Hey, how are you feeling? Has this helped your quality of life? Tell me about the hot flashes. Are they better? Have the night sweats improved? Is your vaginal area more moist? Are you feeling like your sexual activity is where it needs to be? These are things that we can't be shy about talking about, because again, it's all about quality of life. And I never want any of my patients who are menopausal or going through different things to feel like they have to, that it's mandatory that their quality of life has to shift. Your quality of life does not have to shift in certain ways, and certainly hormone replacement therapy can help certain women get to that quality of life that they desire. Now, there are other patients who I have that come in who absolutely want no part of hormone replacement therapy, and that's okay too. Hormone replacement therapy, as I've said, has to be an individualized approach so that each woman feels that she's getting what she needs, especially depending on what her symptoms are. Okay? So those are some things I want you to keep in mind. And I want to finish up by going over a few things, some strategies that all women can use to try to manage their lifestyles and reduce risk. Let's say someone does not yet want to be on hormone replacement therapy. What are some things you can do? So one of the things you can do is if you are on hormone replacement therapy at a low dose, so if you're declining to be on hormone replacement therapy, some things that you can try that many women like to try before they make that decision is you can try some different healthy lifestyle choices. Lifestyle choices meaning, what's going on in terms of your physical activity. Are you able to get in 20 to 30 minutes of exercise, maybe 4 or 5 days a week? And for many women, they feel a difference with that, and they're able to either come off hormone replacement therapy if they're on a low dose, or decide whether or not they want to start it at all. So that makes a difference. Also, in terms of some things that people eat with their diet, I've had some patients, and it's not one of these FDA approved things, but I have many patients who like to add some more soy to their diet as a way to try to replicate that estrogen-like hormone effect and avoid taking hormone replacement therapy. Okay, so that's something else that my patients have tried. Other things that sometimes work for different patients, if you tend to be someone, I'm usually good with like 1 or 2 cups of coffee a day, but sometimes coffee, the caffeine in coffee can sometimes trigger different symptoms in people who are menopausal. If you notice that when you drink coffee or drink more coffee that those symptoms increase, then try removing coffee. I know it's easier said than done. I get it. I'm a coffee person, at least 1 cup a day. But if you want to try lifestyle changes first, that's one of the other things that you can try to see if that works for you. One of the things that a lot of my patients enjoy is if their main concern is the vaginal dryness or is the discomfort when they're having sex. They don't necessarily have to take the pill or something like that. They can just do the cream. A lot of times just doing the cream will give them enough relief that they feel some comfort, and they feel that they can either manage through the other symptoms or the other symptoms are also decreased and improved when they do just the cream, but they eliminate the part where the medicine is going through their entire system. Okay, so those are definitely things to keep in mind when you think about menopause, when you think about hot flashes, night sweats, vaginal dryness, painful sex. These are definitely hormone replacement can help those things, but you don't necessarily have to have hormone replacement. There are other things that you can try. And so I hope that, this discussion today, you guys were able to get some of those, some ideas about other things to try. And, if you've tried those things, I have some patients who try those things who don't want to start immediately on tablets or the patch or something like that. It's absolutely okay to change your mind, to come back and to say, you know what, I've tried eating more tofu, I've tried the vaginal cream, and I still need a little bit more. At that point, what your provider will probably do is prescribe something that has definitely more medicine in it than just the vaginal cream, but something that's absolutely not at the highest dose. Again, that's because of that study that was done that followed women over many years and found those increased outcomes of heart disease, breast cancer, strokes, and blood clots. So again, we don't want that to happen, so we would never put someone on that high of a dose of hormone replacement therapy. We always start them at the lowest possible dose, and we see how they do. So it's kind of like this, it's this back and forth dance that we are absolutely fine to go through as long as we get you to the healthiest space possible. So that's what I wanted to share today in terms of hormone replacement therapy. And I tried to cover topics that came up in previous sessions, but I want to also open it up for questions from you guys. If you guys have any questions about, hormone replacement therapy, some questions that maybe you've had for your provider, maybe you haven't been able to see your provider during the COVID pandemic. If you have any questions, please type them in the chat, and I will cover them. And if for any reason I don't cover them today, we will make sure we get to it in another section. Oh, I forgot to mention, one other thing I forgot to mention, bone fractures. One of the things that hormone replacement definitely helps with is decreasing the amount of bone fractures. And so that's also something to keep in mind. Now, one of the other things that has come out over the last few years is that there are medicines that can only focus on the bone, giving you some bone relief without putting the hormones of progestin and estrogen into your system. So that's something also to think about when you talk with your provider. So let me see. Are there any questions, you guys, about hormone replacement therapy? Ways to decrease hot flashes and make sure that your quality of life is what you would like it to be? That's a big thing that I like to make sure I'm covering with my patients, their quality of life, because everyone deserves to continue enjoying all that they were enjoying when they had their full hormone level, to the extent that they can, especially when it comes to sexuality and sexual dryness. Oh, here's a question. I know there is really nothing normal when it comes to menopause, but is it strange to sweat between your thighs when you are asleep? That's not strange at all. Kelly, thank you for that question. It's absolutely normal. What happens is the body temperature tends to go up a little more at night. That's one of the reasons why sometimes when people have partners, when women with menopause have partners, a lot of times there'll be a struggle in terms of what setting the air conditioning's on at night, because women who are going through menopause will sometimes feel warmer at night. And so that warmth can evidence itself in many different ways. You can have sweating all over the body, including in between the thighs. Sometimes women feel they have to kick off the covers so that they can feel a lot cooler. And so absolutely, that's not a strange thing at all. I hear that concern from many of my patients, the night sweats, and that's absolutely normal. Hi, Colleen. Thank you for joining today. Someone suggested Chinese herbs. Is that okay? It varies, Colleen. So it's one of these things where Chinese herbs, I've seen them work in a lot of people. Some patients will come to me and say, hey, doc, I got this from GNC. What do you think? And so I've seen some people that it works with them and other people that it won't help them at all. One of the challenges is that the herbs or the things that we try that are natural products from GNC and all that stuff, they haven't been reviewed scientifically. So the Food and Drug Administration, or the FDA, hasn't studied all the Chinese herbs to say, what's absolutely likely going to work better in someone, and what's something that is is just out there to be sold that maybe won't have any impact at all. And so I would say, if you have tried something that you feel it works for you, then absolutely use it if it makes you feel good. It's also okay. I have patients who do this all the time. Sometimes they'll ask me about something and I'll say, you know what, bring it in for our next visit, or show me on a telehealth visit, and I will do some research and give you some feedback about whether or not that might be helpful. The biggest thing is that if you take something, that it does no harm. So when I'm researching these things with my patients, even if I can't find scientific data to say that it's helpful, I absolutely want to make sure that it's not going to do them any harm based on their unique medical situation. Okay? So that's important as well, to make sure it does no harm. I have another comment question. I usually have a flash from my lower back to my neck, and sweating between the thighs is new. Yes, a lot of times the sweating, the night sweats, or even the sweating during the day, it can change over time the longer we have been in menopause. And so if the average age is 51, a lot of times women notice the most changes between about 3 and 5 years after menopause starts. But I've also had patients who are noticing changes and feeling really strong menopausal effects even as far out as 10 years after menopause. And so, again, menopause is one of these things where everyone's body kind of processes it very differently. But absolutely, Kelly, it's one of these things where you can have different symptoms present themselves depending on how long you've been in menopause. Okay? Do most women find they lose their sex drive? Yes, a lot of women do. So I would say, of my patients who approach menopause, they talk about how their sex drive has decreased. And that's something that's absolutely due to the shift in hormones. So when our bodies go through, whether it's natural menopause and you haven't had any surgery, or if it's surgical menopause, maybe some women have had a hysterectomy and their ovaries were removed, and that's surgical menopause. Absolutely, the loss of estrogen, progesterone, and testosterone, because that contributes to our sex drive, the loss of those suddenly from your body will absolutely impact your sex drive. And that's actually a key reason why some women want to try hormone replacement therapy, because they want to make sure they can, maintain their groove, make sure they can be sexually satisfied for themselves and for their partner or partners. And so that's absolutely the case, Kelly, that a lot of women do find that they lose their sex drive. On the other end, rarer, but still it happens sometimes. I've had patients whose sex drive increases after menopause, and they come in because their partners can't keep up with them. So I've seen the whole range, but definitely most women fall into that middle category of losing their sex drive, or at least having a decrease in their sex drive. Okay? Are there any over-the-counter creams that work and can be recommended? Let me check. There were some creams that were on the market within the last year or so that I think were pulled for a variety of reasons. So let me double check what's currently on the market and type in the chat later so that I can make sure I'm recommending the right ones. Again, a lot of the over-the-counter creams have not been FDA studied, but I'm gonna respond to that later in the chat. Thank you for that question. I'll make sure that I research and get back to you about some things that might be over the counter that you can try. Okay. Hey Janet, thank you for joining today. I appreciate you being here. And now we have another comment. It says, I had serious night sweats in my early 40s, and since changing my diet, no more night sweats. Thanks for this info. Thank you so much for that comment, ma'am. Yeah, I definitely have patients who describe that they might change their diet, increase fruits and vegetables, add in some soy, decrease red meat, add in more exercise. I've definitely had a lot of patients who describe feeling better overall after they make some of those lifestyle changes. So thank you for saying that. And Patricia, I'm writing this down so that I can type into the chat for you ladies later some things that might work in terms of over-the-counter creams. Okay? So thanks, guys. I hope that you guys got some good information today. Our chat about hormone replacement therapy. Is it for you or is it not for you? Again, just some things to consider in terms of your family history, how bad your symptoms might be, whether or not you're interested in trying a low dose of something systemic, or trying a vaginal cream. So, just again, some questions to keep in mind for when you see your provider so that you can make the best possible decision for you. Okay? All right. Well, thank you for being here. I'm going to sign off now. Again, my name is Dr. Madeline, your board certified OB/GYN. I want to know if soy is bad for you. Okay, let me see this question. So there are, I'm not aware of any studies saying that soy is bad for you. I think like most things, anything in moderation. And so, I have some patients who will eat tofu and eat different things with soy, and it helps their symptoms, and, I haven't seen any bad outcomes. Now, I think a few years ago there were some reports about negative outcomes with soy, but that was in a situation where I don't know that they were able to prove that with follow-up data. But again, it was in a situation where people were really eating, like, what is an excessive amount of soy? I don't really know, but if you're eating it 6 times a day, large quantities, something like that, similar to when the recommendation came out about pregnant women limiting their mercury while they're pregnant. If you would have to eat like, I don't know, like several large shark fish every day to have the level of mercury that would make it a problem for a pregnant woman to, to eat that amount of fish, or for mercury to be a concern for her. So I think it's the same with soy, Chandra, that anything in moderation. So, if you have a moderate amount of soy as part of your diet, that has not been shown to have a negative outcome on the ladies that I've cared for, even in the studies that I've seen. So again, when I type into the chat regarding the over-the-counter creams, different options that might be available that might be okay and deemed safe and healthy, I will also add in information if I find information about soy. Okay. Oh yes, Chandra. Yes, that was. I think that was debunked. The breast cancer risk in soy. It was debunked, but thought to possibly be of concern or something to watch out for if someone was taking in large quantities of soy. Okay. All right. Well, thank you guys again. And what I will do is I will put in links to more information about the soy, but also for the over-the-counter creams. And so again, I'm Dr. Madeline, your board-certified OBGYN, international speaker, and published author. I help busy women access the accurate GY information and birth control that they need so that they can live their lives with as much freedom and control as possible. And overall, a healthy sexual life leads to an overall healthy life. And so if you would like to get more information, please follow me on Facebook, Twitter, or Instagram at Dr. Madeline MD. That's DrMadeline MD. And I'm so glad you ladies joined today. Thank you so much for being here. And if you have more questions or information that you'd like for us to discuss on a future Sunday chat, please by all means type it on my Facebook page, Dr. Madeline, or just send me a DM, and I'll make sure that we add it to our list of topics, okay? Thank you guys. Have a great day. Bye-bye.